Hi, I'm Dr. Mark Graves. I'd like to talk to you today about a medication that can help you with your weight loss project. This segment is about the use of Phentermine. Another video, Weight Loss Medication, The Basics, will greatly enhance your ability to use this video. I strongly suggest that you watch both of these videos if you're considering the use of Phentermine. The obesity treatment pyramid is one of the best methods to work on the obesity problem. We're struggling against the built-in tendencies of our bodies as well as social and other factors that making lose weight hard. The treatment pyramid is designed to work on best medical evidence-based principles for success. The first level in the obesity treatment pyramid is skills training and education. A successful dieter needs a toolkit of coping and management skills to lose weight. Losing weight is hard. From the beginning of humanity, our bodies were built and are very efficient at seeking out, saving, and storing every single calorie. This slide summarizes the 4 treatment levels in the obesity treatment pyramid. Medications work through controlling hunger and helping you feel more satisfied, but they don't work without the intent to improve your diet. Medication is the 3rd level of the obesity treatment pyramid. There are many important components in level 1 and 2 that help build a successful diet. Other video segments in this series include details about these critical components. I strongly suggest that before you start medication, you study and are very familiar with the other videos in this series. This slide is an illustration slide from a specific weight loss medication. I'm including this slide to illustrate several important general points. Not all patients respond to the same medication. Usually 12 weeks on a medication should produce at least 3% weight loss, and we should achieve 5% at 6 months. Some patients achieve a lot of weight loss with medication and some very little. Also, the weight loss response of an individual patient is commonly different for each of the medications. 5% weight loss is considered medically significant and has measurable health benefits for you. If you do not achieve this level of success, more help in the form of more education is in order. If there's less than 5% weight loss, I typically change medication or change the dose of the medication. In discussing weight loss medication, it's helpful to understand the normal process of digestion. Food starts out in the stomach. This is about a 2-cup sized pouch where food spends about 30 minutes to 1 hour. Food then moves into the small intestine, a long, thin, garden hose-sized tube about 23 feet long. As the food travels down the small bowel, the nutrients in the food are chemically digested and placed in the bloodstream. Food spends about 3 to 6 hours traveling down the small intestine where the nutrients are absorbed into the blood. The residue next goes into the large bowel where the water is removed. The residue spends about 1 to 3 days in this location until you go to the bathroom. A summary of digestion can be characterized in this mental image. 4 hours after you eat a pound of food, there is a pound of food in the blood. Where your body puts the nutrients from the blood is a core problem with obesity management. Other videos entitled How Your Body Works, Your Body is a Machine describe the next phase of food processing, where the nutrients are removed from the blood and are stored. This segment on the GI tract describes the signals that are generated when the food passes down the digestive tract. Hunger and satiety are different sensations and are controlled by the brain, but the sensors are in the bowels. Hunger is your body's sense of need to put food in the stomach. Satiety is your body's sense of need to put food into the small bowel. The sensors for satiety are in the small bowel, about 22 feet downstream from the stomach. In order to be optimally not hungry and to be most satisfied, we have to get some food to both of these sensors. This is why we should start a meal and wait 20 minutes before we have our second course. It is also why eating slowly helps you feel better. Other videos entitled How Your Body Works, Your Body is a Machine describe the details about the content and timing of a meal can help you feel better. The effect of Phentermine on chronic weight management is due to the release of catecholamine, a brain chemical, into the hypothalamus. This reduces both hunger and it produces a bigger sense of satiety with smaller meals. Working together with behavioral change and a lower calorie diet, the result is weight loss. This slide is taken from the package insert for Phentermine. Phentermine is a generic medication that's been used in clinical practice for more than 20 years. Phentermine is called a sympathomimetic. This is a class of medication that activates the fight or flight body systems and is used as a short-term help for weight reduction. It's also used as part of a therapy based on exercise, behavior modification, and caloric restriction. The side effects of this medication are sleep difficulty, palpitations of the heart, and it can increase the blood pressure. This medication was used in a combination 20 years ago called Fen-Phen. Some people may remember that Fen-Phen caused heart valve problems. Phentermine is not the half of this pair that causes the heart valve problems. Phentermine is FDA approved for use in 3-month intervals. If my patients lose 3% of their body weight in 3 months, I will continue to use the medication in a cyclic fashion, 3 months on and 3 months off. Phentermine is a generic medication and the price is reasonable. There are some side effects from this medication. I caution all my patients who start this medication to watch their blood pressure. The medication also causes some sleep trouble. It should only be used first thing in the morning. I also note that if you forget your dose and it gets to be lunchtime, I think it's important to just skip the dose for the day. Finally, it can cause palpitations like caffeine. I suggest that you quit caffeine while you're on this medication. Losing weight is a hard project. I suggest that you become familiar with all the principles of the obesity management pyramid before you even begin this project. I also suggest that you investigate communication tools with your primary care physician. Some doctors use electronic communication like MyChart. Other doctors prefer to use a health coach or a dietitian. If you would like to further discuss weight loss strategies, I suggest an appointment with your primary care physician. You and your doctor can work together to design the best weight loss program for your individual needs.